Many people think that laboratory blood work is something you have done because your doctor's looking for disease. Then you're either relieved or upset when the results come back. With wellness care, blood work is seen differently. It's a window of opportunity to look at your blood chemistry and take steps to a higher level of health. Here's Dr. Howard with some insights about laboratory blood tests and wellness.
What happens when you walk into a physician's office and they decide to order blood as a result of what you came in for? One of a couple things, right? So they get the blood test results back, and if there's a disease process, let's say, going on. For example, you may have diabetes or be pre-diabetic. Your cholesterol may be way too high, right? Your inflammatory markers are off. The thyroid is definitely showing hypothyroidism. So what happens? You get labeled with a diagnosis, and as a result, usually there's a pill that's prescribed in order to take care of that. Or, on the flip side of that, what happens? You walked in with a series of symptoms because you know you're not feeling right, and the blood work comes back and your doctor says to you, everything looks good, I don't know what it could be. And there's no other alternative. Well, what's fascinating is in the world of functional medicine and wellness, we look at blood very, very differently. Yes, disease is important, right? We want to know if we're dealing with something like that so that we can address it on a more natural route, which a lot of times can be safer. But at the same time, there's this in between, right? Between being perfectly healthy and getting clinically sick. And a lot of us are wavering in between there. So let's take thyroid, for example. Tons of people walk into the office thinking they have hypothyroidism. And when that blood test comes back, nope, perfectly normal. Well, we look at much smaller ranges sometimes in the world of functional medicine because it can take a while where those blood markers would actually change to get that diagnosis. And we know on a much more subclinical level that that thyroid is already on its way. And that's the beauty in wellness medicine, is not only do we look from a prevention standpoint, but already you've been working on it standpoint. We don't wait until you're in that complete disease state, to hope that there's a magic pill to wipe that out. So blood work can be really, really important and very eye-opening. It's like building a foundation, if you will. If we can lay a proper foundation, let's say we're building a house, those walls are going to stay up, that roof is going to stay strong. Blood work is no different. We want to make sure that the foundation for everybody's health is there in order to prevent disease. And if you unfortunately are already on your way, there's so many cool things that blood work will allow us to look at so that we can pull you out of it and keep you from getting there.
Some people are afraid to have their blood tested because in their mind, they don't want to look for trouble. Let me suggest instead of a fear-based approach, wellness is a positive approach. Your clinician can look at your blood and begin to boost nutrient levels that are low and point you in a direction of optimal health. Ask your wellness clinician about laboratory tests and blood work that can open a window to your future with better health, feeling younger, and enjoying life.